Desai with Toppickmedia. Today we have Dr. Vivek Mehta from Global Institute of Spine and Joint Care in Arlington, Texas. He is the CEO and Medical Director of Global Institute of Spine and Joint Care at Arlington, Texas. Dr. Mehta has been professor and he has been a faculty at multiple universities across the country. He was the director and professor of pain management faculty at University of Miami and VA of Miami. Dr. Mehta has more than 30 years of experience as a physician and pain management specialist. Welcome, Dr. Mehta. Thank you for giving us your time to interview you and learn more about what you do and the specialty you offer.
Thank you.
Tell us more about yourself and your journey as a doctor.
Well, I was, I think, in fourth grade when I decided that I want to be a doctor. And God has been very kind to me that my dream was fulfilled. So as it happens in India, you have to appear in entrance exams to attend medical schools. So I attended Armed Forces Medical College, which is in Pune, Maharashtra.
Okay.
After that, I joined the Indian Army for a few years. In the Army, I did all kinds of things that doctors do, especially being a part of the special ops, the NSG, the anti-hijacking and anti-terrorist operations of Indian Army. I was a doctor for a few years there, the commanders, the top commanders of the world.
Yeah.
So I was with them for some time.
That must be some experience.
Yes,
you must have learned so much.
Yes, that was very, very amazing experience.
That's so cool, yeah.
After that, I moved to the Middle East for a few years and then came to the United States. In the United States, I did started my career from UCLA and USC. I started my fellowship from there in endocrinology and then did my residency and fellowship at different universities, starting from NYU to University of Miami, where I did my pain management fellowship also.
Those are all very prestigious universities that you've been to.
Thank you. So then I joined as a faculty.
Okay.
And I led my department for a few years. Following that, I came to Texas, started in a place called Tyler, which is east of Dallas, about 100 miles from here. And I was the head of pain management and neuroscience program over there.
Okay.
Then came to Dallas and started my own outfit, the Global Institute of Spine and Joint Care, in 2011.
That's an impressive journey.
Thank you. Since then, we've expanded widely. We have multiple locations, and we've been very blessed. We have a very large referral base. We get patients from Dallas-Fort Worth Metroplex, from all over the state, all over the country, and internationally.
Wow.
Our patients come from all over the world, including India, Pakistan, Middle East, and South American countries.
So language must be really a barrier with those international patients. How many languages do you speak?
Well, I speak obviously Hindi, English, Urdu, Punjabi.
Wow.
And I speak pretty fluent Arabic and Spanish also.
That's
myself.
Great. Lucky patients who find you. So,
Thank
because
you.
I think even as a clinician, I feel language can be a huge barrier when you can't understand what patients are trying to convey when they can't speak in their own language. So
Absolutely.
that's
yes,
a huge advantage when a doctor understands the language.
Sure.
So that's great to know. Good to know for our viewers that you are able to communicate in so many languages.
Sure.
So tell us about pain management specialty. What is pain management and what does a pain management clinic offer?
Well, pain management as a specialty is a very interesting branch of medicine. Typically, as you understand, pain is a symptom of a disease.
Right.
For example, if you have chest pain, you may be having a heart attack. You take care of the heart attack and pain is gone.
Right.
Also, when you have appendicitis, you have abdominal pain. Once you take care of the appendicitis, pain is gone. But there's a state when pain becomes a disease, or pain is the main problem that patient is having. That's where pain management as a specialty gets involved. And we take care of pain in a multimodal manner. Medicine, pain medication being the smallest part of it. That is the smallest thing we do. But we do mostly interventional pain management, where we offer various minimally invasive surgical modalities to the patients. For example, people having spinal pain. We can take care of those problems without subjecting them to open surgery.
Okay.
And then of course involve various other modalities of treatment, psychiatry, physical therapy, occupational therapy,
Yeah.
and other things.
Okay. So when you talk about this in minimally invasive surgeries, are they just performed in your office, or does the patient need to be hospitalized for that? How does it work?
Well, it depends. There are a lot of procedures that we can do right in the office.
Okay.
But there are certain other surgical procedures that have to be done in the hospital, which require an OR environment.
Okay. But basically what you do is find the root cause of the problem and treat that rather than just treating pain and making medication as a main part of the management.
Not at all. You're absolutely correct. Medication is what we want to take the patients away from.
Right.
Our job is to make sure that the patient's pain comes to a lower level. They're using the least amount of medication, and they are most functional. Those are the three objectives that we want to have in our treatment.
So generally, like if somebody has pain, they just go to their primary care physician. Everybody has primary care physician, and they'll go there and they'll get the pain medication for months. Sometimes I get patients who have been on pain medication for low back pain for 2 years and did nothing else at all. So when does a patient figure out that I need to go see a specialist for my pain and not just a primary care physician? How can they make that decision?
Well, that decision is to be made by the provider primarily, but the patient can always inquire from their primary cares whether it is time to see a specialist. Ideally, any pain which has lasted more than 3 months should be investigated by a pain management specialist.
So any pain that has been there for more than 3 months is considered chronic pain, and a patient needs to be investigated more in detail?
Yes, the definitions of chronic pain can vary,
okay,
but anything which has lasted for more than 3 months should be investigated by a specialist, for sure.
Good to know. I think that's going to help a lot of people who have been in pain for a long time to kind of rethink what kind of treatment they're getting and if that's the optimal treatment they should get.
Okay.
So thank you for sharing that.
Sure.
If somebody is in chronic pain or has been in pain for more than 3 months, what is one advice that you would give them when they are considering receiving pain management or going to a pain management clinic and finding a specialist?
Well, the thing is, what I would recommend to the patients is to make sure that they understand the disease process well, be well informed, and try to find the most ethical doctor that would treat you for your problems and keeping your interests in mind. That's the primary thing. So do your best to find a reliable doctor who's got great reputation in the community, and your physician also, your primary care also thinks good about them.
Yeah. Okay. And lastly, I think we are having an opioid epidemic in the United States. People are so much dependent on pain medication because that's just something that's easily given. And I think the trends are changing. The rules and regulations are changing. But what's your take on addiction to pain medication, and how can your clinic, why should one choose Global Institute for Spine and Joint Care?
Well, the thing is, pain medication epidemic has been there for a long time. The system has just started realizing it is there.
Okay.
Practices like ours, we always knew how to manage pain appropriately. So these kind of restrictions and state guidelines which have changed have not affected us because we always did the right thing for the patient. Our aim was always to minimize medication use and maximize patient's functionality. Now, the problem started when the whole system wanted the patient's pain scores to go to 0.
Right.
And that's where doctors were forced to write excessive amount of pain medication because the patients were saying they are in pain. And then when they're saying in pain, the doctors were forced to prescribe it.
Right.
Now the pendulum has swung to the other side. The system is waking up, oh, that's not what we did, what we wanted. We did it wrong. Now those changes are going to be effective, and those changes are going to be beneficial to the patients and to the doctors too. And I think, your question is what we do and why should the patients come to us? Well, what we do is the most ethical form of medicine. We will always guide our patients in the right direction. We will make sure that their interests and their betterment is the only choice that we are following, and nothing else.
That's great, because I think it's really difficult to find doctors these days who are actually looking out for patients' goal and their aims or their expectations from what they want in their life and what kind of life they want to lead, rather than just doing pain relief. So I think it's very important for a lot of people, because they might just want to play with their grandkids. The pain is not their priority. So knowing that there are other options and there are specialists in the community that you can help them achieve their goals, life goals, can be huge for some people. So thank you for joining us today and giving us your time and knowledge. And thank you everyone for joining us.
Thank you.